hormone replacement therapy. The purpose of this video is to educate and inform you about our testosterone and hormone replacement therapy and how it has successfully worked on hundreds of patients. If you have low energy, feel fatigued, have sleep difficulty, muscle loss, experience erectile dysfunction, or have low sex drive, if you experience a noticeable decrease in everyday enjoyment, you may be suffering from low testosterone levels and you need to address it. After all, how do you think you will feel if you ignore this? How do you feel you're going to feel in a year from now? How do you think you're going to feel 3 years from now? 5 years from now? Everyone wants to experience more energy, increased stamina, feel revitalized, and have a general sense of well-being. I'm here to tell you how. Listen carefully. At first, we are going to review what is testosterone and why you may need testosterone or hormone replacement therapy. Testosterone is a hormone produced by your body. During puberty, testosterone helps build muscles for men and deepens their voice. In adulthood, it helps a man keep their muscles and bones strong and maintain their interest in sex. But as you age, your hormones decrease. When your hormones decrease, the aging process accelerates and you will look older than your age. This is why it needs to get replenished. The proper balance of hormones will make you feel good and youthful again. The problem is every day and all day, your body is losing cells and replenishing them. So as you get older, your body's ability to replenish your cells diminishes and causes you not to have active, energized cells. Sounds familiar? For these cells to function optimally, your hormones must be in good balance. Your hormones are the driving engine of your body, and they are often overlooked. When you have low testosterone, it affects multiple organs of your body. It affects multiple functions of your body. Testosterone is not only a sex hormone. It has multiple benefits for your body. And if there is not enough of it, you will experience these symptoms as I mentioned before. Unfortunately, many patients do not relate their symptoms of being fatigued, have low energy, low sex drive, and sleep difficulty to a possibility of hormone deficiency. You need to understand, after age 30, most men begin to experience a gradual decrease, gradual decline in testosterone, and as a result, a drop in sex drive. This is often referred as andropause. Your testosterone levels drop by about 1% a year beginning the age of 40. This is not even considering if your body is toxic, if you have a toxic diet, if you're smoking, being overweight, so on and so forth. He also stated testosterone deficiency is massively underdiagnosed problem. Out of 100 people who have low testosterone, only 5 of them receive therapy. So 5%. Low testosterone symptoms can be very similar to symptoms of other illnesses. That's why they're often overlooked. It could be a brain signaling issue. It could be your body doesn't produce natural testosterone. It could be a testicular issue. Or it could be all of the above. What causes low testosterone is natural aging, chemotherapy, medications, stress, and smoking. As a result, you start having symptoms of low energy, decreased libido, weakened erections. You don't enjoy life as much anymore. You feel sad often, loss of strength. It affects your sleep, your mood, affects your ability to play sports or be active with your spouse, children, grandchildren. As a result, daily routines become affected. Your life becomes affected, your marriage becomes affected, your work becomes affected. Sounds familiar? Common symptoms associated with low testosterone are, again, erectile dysfunction, decreased libido, decreased energy, fatigue, trouble sleeping, decreased muscle mass, not getting a good response from exercising. That is, if you have the energy to exercise. Irritability, mood swings. Male breast growth called gynecomastia. And other medical physicians, they say, okay, go ahead and do plastic surgery. It's going to fix that. Our physicians are here to help you to find the underlying cause and help you. Testosterone therapy has helped hundreds of patients to look and feel better as well as get their life back. A common patient scenario on their first visit is, Doc, I'm 50 years old, I look 65 years old, and I feel 90. After their first cycle of testosterone treatment, it is not uncommon to hear from the same patient, Doc, I'm 51 years old, I look like 40 years old, and I feel 30 again. I'm full of energy. Results like this are realistic. What testosterone therapy does, it helps your overall well-being and improves your vitality and health. Some relate hormone replacement therapy or testosterone therapy with side effects. Google it. Cancer is being the worst. They may have heard it is in the news. They may have heard it on the internet or from their friend. Well, it is partially correct. Synthetic hormone therapy could cause cancer. So these people are talking about synthetic hormones and not bioidentical or natural hormones, which is what your body is producing naturally, which is what we are talking about. Bioidentical hormones chemically mimic those your body already produces and is not considered foreign to your body's natural chemistry. Therefore, your body feels that your body is producing it and utilizes it. The synthetic hormones are not even hormones. They trick your body to think it is hormones. Let me be clear. I'm not telling you to stop or start any care or medication. This is the job of the physician who prescribed the medication for you. I'm not curing anything. As you know, in healthcare, there is no guarantee for any treatment. Although our medical physicians report most patients feel better, you are an individual and your results will vary. In functional medicine, the medical professionals combine your symptoms, lab testing, and physical examination to formulate a treatment plan for you. In addition, I may provide you natural supplements to improve your overall well-being and your health. I want you to understand something about blood test. Blood testing for normal testosterone usually ranges. Different labs have different ranges. If you are a 50-year-old male and you go to LabCorp, for example, they will have one set of normal range versus Quest Diagnostics has another set of normal range versus BioReference Laboratories have another set of normal range. I don't want to go off topic now, but this is what it is. I have seen normal ranges for testosterone from 300 to 1100, which is a huge, huge range. I can see a 50-year-old guy who has a testosterone level of 350 versus another 50-year-old guy who has a testosterone level of 950. And they are both labeled as normal. This is insane. You and your physician cannot only rely on the labs or blood test. This is what differentiates from regular traditional doctors with functional medicine doctors. There are a lot of false positives and a lot of false negatives, which is why our medical physicians will put more importance on your symptoms while considering your lab results. Many times your testosterone levels may be in normal range, but your body may still crave the testosterone because this is what is right for you. It's an individualized program. Many patients experience better mood, more energy, and a sense of vitality after only a few weeks, thus realizing how good they really can feel. So step 1, you will fill out a comprehensive qualifying questionnaire. Step 2, you see one of our medical professionals to evaluate you and see if you qualify for the testosterone replacement therapy program. Then our physicians either order blood tests for you and you start the preliminary therapy the same day, or we will wait for the results to come back depending on your symptoms and our physician's findings. Step 3 is payment and financing. You will meet with one of our new patient coordinators to discuss your options. And step 4, begin your program. If we accept you as a patient, we will order the testosterone kit for you. You will receive it at home. It's a New Jersey state law. Then you will bring the kit to the office. This therapy is performed in the office once a week for a few weeks, depending on your needs. Then you may self-administer it at home, or you could bring it to the office that we do it for you. It takes only 3 to 4 minutes per week with scheduled monitoring. We have seen many patients with low testosterone levels suffering from weight gain or not be able to lose unwanted fat. If you are one of them, you may also benefit from our medically supervised HCG and weight loss program. These go hand in hand. Like I said before, we are here to change your life and help you each and every step of the way. We are offering a free, no obligation consultation expiring in 7 days from today. We only accept 4 patients a week for this program. So if you want to have more energy, increased stamina, feel revitalized, and have a better sense of well-being, give us a call for a free, no obligation consultation. I hope you have found this informative and useful. My name is Dr. Maz, and God bless.